Morning. Thank you for coming. My name is Peter Cassell. I'm a spokesperson for the Department of Health and Human Services. I'll be your MC today. We have a couple speakers here from all of our partners who are part of this operation at the Las Vegas Convention Center. This is a very large operation where we are providing second dose vaccines to a very significant number of residents here in Las Vegas. I'd like to introduce our speakers, Brad Austin, who's with HHS, Dan Frazee, who's with FEMA, who's sitting to my right, Jeff Quinn, who is with the Southern Nevada Health District, and Ryan Glassford, who's with Clark County. So with that, we will deliver some remarks, and then afterward we'll open it up to questions from you guys. So thank you for social distancing. Before we get started, there are two quick things I want to just note for you. One is that you probably saw in the media this morning that the number of vaccines given out nationwide have surpassed the number of COVID positive cases, so that is a positive sign. The other is that this morning the groundhog saw his shadow, so allegedly there will be 6 more weeks of winter. So that's a fun fact for the day, and I will turn it over to Captain Austin to start the presser.
Thank you, Pete. Good morning, folks. I'm Captain Brad Austin with the U.S. Department of Health and Human Services. I work for the Office of the Assistant Secretary for Preparedness and Response. And as an ASPR employee, we are committed to helping your community, Clark County, save lives and end this pandemic. In partnership with the Federal Emergency Management Agency and the rest of the state of Nevada, the U.S. Department of Health and Human Services deployed a team of 40 vaccinators and administrative support personnel from the National Disaster Medical System to Las Vegas, as well as other areas here in the state of Nevada, to help expedite vaccinations in the state. The team of 40 NDMS personnel will split into smaller task forces to support several vaccination sites across the state. 30 of those vaccinators are here at the Las Vegas Convention Center, and they're starting work this morning to vaccinate here at the center. The locations of the sites that we're going to are determined by state and local officials in partnership with the Federal Emergency Management Agency. The NDMS personnel will work with clinical and support personnel from other federal, state, and local agencies to support each vaccination site. These vaccination sites include fixed facilities like this one, pop-up or temporary vaccination sites, and even mobile vaccination clinics. The vaccine is, it's not a perfect fix. Everyone should continue to practice the 3 W's, and that's wash your hands, watch your distance, and wear a mask when you can't watch your distance, and avoid settings where you can't do any of these 3 things. And with that, I thank you.
Thank you. We'll turn it over to Dan Frazee from FEMA.
Good morning, my name's Dan Frazee, and it's a real privilege for us to be here in Nevada and specifically Clark County to help and support the ongoing efforts here. We've got approximately 60 FEMA staff in the field doing things from administrative support to greeters to facility support, logistical support. All that's at the direction of the state of Nevada and the Clark County leadership. Very pleased to be working with HHS and Brad Austin. And there's been a ton of good work done here over the last weeks and months. And once again, it's just a real privilege to be here and help out with that. We've got 2 or 3 geographic locations working right now, and we're supporting the vaccination efforts. But to be clear, FEMA's not doing medical work. We're just simply support. We're doing hands-on. We're doing things as simple as delivering commodities, setting up on tables and chairs, data entry, things like that to enhance the overall operation here. We've also got staff working in northern Nevada as well, and however, my focus today is Clark County and what's going on here. We've got, in the past year, FEMA's provided $568 million to support COVID operations. We're truly honored to be part of this team in support of the state and the county and the Southern Nevada Health District. There's clearly some very dedicated people here. We're very passionate about this operation, this mission, And once again, my name's Dan Frazee with FEMA.
Thank you. That concludes the federal portion of this, so we'll turn it over to our critical partners who are our local health partners here. So first, we'll turn it to Jeff Quinn with the Southern Nevada Health District.
Good morning. I'm Jeff Quinn, Public Health Preparedness Manager for the Southern Nevada Health District. I'm pleased to be here representing our partners today on the first day of operations of our second dose closed COVID-19 vaccination clinic. I want to thank our partners, including the Las Vegas Convention and Visitor Authority, Clark County, the Nevada Department of Health and Human Services, the Nevada Department of Public Safety, Division of Emergency Management, the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Preparedness and Response, U.S. Department of Homeland Security, FEMA, and other local response partners. The Las Vegas Convention Center site is currently set to administer approximately 1,400 doses of vaccine each day with a capacity to expand to 3,000. This site is specifically for people who receive their first dose at a health district or partner vaccination clinic. We want to reassure the public that this is done to ensure that everyone who got their first dose receives their second dose. If you were vaccinated by another provider, they will be receiving a second batch of COVID vaccine just for you. We have also implemented a new section of our website that allows people who were vaccinated at a health district clinic to register for their second dose. We ask for people's patience as it is getting a lot of traffic at this time. Please check back frequently if you cannot access it right away. We are looking forward to working with our partners, providing services at this site. Thank you very much.
Thanks, Jeff. And then we'll turn it over to Ryan with the Clark County Fire Department. He's our battalion chief here.
I got the easiest answer out of the whole thing. Because of a canceled meeting and us pushing another meeting, I'm going to turn it over to Clark County's emergency manager, which is Billy Samuels. That's why we're allowed to be here.
Thanks, Ryan. I don't have that same answer that he has. I wish I did. Billy Samuels, Clark County Fire Emergency Manager for all of Clark County. Our main role in this is the coordination efforts between the federal, state, and local partners. Mainly, the Southern Nevada Health District is leading this IAP that we're supporting them as well, but we can only do so much with the personnel that we have here, which is why I put in a resource request to the federal government, HHS, ASPR, FEMA, and the Nevada National Guard. Like Jeff Quinn said, it also comes down to facilities. The Las Vegas Convention Center has been an amazing partner, not only during this event, but during events in the past. So I think we need to really thank them, and we actually have a location to where we can do an operation to actually help the citizens of Las Vegas and the state of Nevada, and then all the citizens of America. So thank you. If you guys have any questions, we'll turn back over to Pete.
Sure. Just to close this out, the efforts here at the Convention Center are a critical part of President Biden's efforts to get 100 million doses of vaccine administered in his first 100 days. With that, I will take your questions, and we can, have our esteemed panel here answer them. Sure, I'll turn that over to our local partners.
Yeah, so, I think it's vigilance. We have to ensure that we make the proper notifications to those that got first doses at one of the SNHD or community vaccination sites. So folks get notified through email or text message with a link that encourages them to make the appointment for the second dose vaccine. That is done every day, so that each day that we've been rolling out vaccines since December 14th, once people come up on their 3 weeks to 4 week time frame, they should get a notification in the mail to make an appointment, to register each day, and it will continue on indefinitely until, as long as we're open at this site and we have enough available vaccine that we receive down here in Clark County.
And I think it's important to note that something that Captain Austin said, which is the vaccine is great, but people need to remember to continue to practice the 3 Ws, to watch their distance, wash their hands, and to wear their mask when it's appropriate.
As far as the health district is concerned, you guys have, multiple sites around the city. The pop-up locations are coming online. Was it a decision to say, wherever you got your first one, don't go back there again? Why was that decision made? And then what led you to the convention center here as a catch-all for all of that?
Right. Now, based on the Southern Nevada Health District's website that lists all the vaccination locations in Clark County, it's important to have those providing first doses to the community. What was needed and the reason that we established the convention center as a high throughput area is a location to do just second doses. Not first doses. We don't provide first doses here at the convention center, but for every community site that we have where we're providing first doses, this location serves as an ideal location centrally located in the valley to capture the second dose vaccines. Now, as we expand, as we get more vaccine into Southern Nevada, we're working with our close community partners, the Division of Emergency Management with Clark County, our federal partners, to be able to staff and logistically support additional vaccination sites. So, and those will be first dose vaccination sites. Now, if somebody received vaccine from one of the other community partner providers, UNLV, UMC at the Encore, really they need to go back to that site to get their second dose. And the reason is that it's a separation of vaccine supply. The first dose supplies that we provide at SNHD vaccination clinics is one source. After we administer those first doses, an automatic shipment comes for the second dose to the location that actually provided that vaccine. So, we're directing the public to go get the second dose at UNLV if they got their first dose there, because they will actually have the vaccine on hand for that second dose. If they come to the convention center to get a second dose, then they're taking away a second dose for somebody that went to one of the SNHD clinics to get vaccine.
Sure.
Well, I think it is right now with limited supply of vaccine, it's very widespread. I mean, really, we can only set up appointments and release enough appointments for the amount of vaccine that we have on hand. As you've seen across the country and other states and jurisdictions where they booked out appointments for weeks and weeks and weeks, didn't have enough vaccine to provide that. The worst thing that we could do is have our vulnerable populations out in the elements, waiting to get vaccine only to tell them that there's no vaccine for them to do. So we allocate the number of appointments that we have based on weekly shipments of vaccine that we're likely to get. And we don't know, we only have a week advance notice for the amount of vaccine that we know that we're going to be actually administering. So it's not like we have weeks and weeks and weeks of advance notice to notify people. The best we can do is make limited amounts of appointments, and then conserve the vaccine. If we have some of the other community partner sites not administering as much vaccine, to ensure that we're not wasting vaccine, we bring that vaccine back to the health district, open up more appointments at some of the other community fixed sites we have. So we ask the public to constantly go back, and even if there says no appointments are there, constantly check those for new appointments that open up. As we get some of this vaccine that comes back, we open up more appointments so we can get more people vaccinated.
If I can add, from the federal viewpoint, it's important to notice that the vaccine timelines are not hard and fast. The federal government is the organization, is procuring the vaccine from the two companies right now, and as soon as it comes off the production line, it is shipped out to the states. And I think we're doing a very good job. I think we've announced to the states there's a 16% increase in the number of vaccine that's coming out this week, and I think we've guaranteed that it will remain at that level for the next three weeks. But we as a nation are dependent, if you will, on the amount of vaccine that can be produced at any one time. I can tell you that the state every week is told how much vaccine they can order from the federal government, and then the state government does go in and they do order all of that vaccine, and it is shipped. When it is ordered, I believe that at that time the state also has to indicate to where the vaccine is shipped, and it's directly shipped to those locations. So I can tell you that the amount of vaccine that is offered to the state is accepting and is actually and it's actually being shipped out across the state.
Can you walk us through step by step the process of booking an appointment here for the convention center?
Sure, that's definitely a local partner question, so we'll turn that over to you.
Okay, great. If you go to our Southern Nevada Health District website, snhd.info in a browser, you find our COVID resources page. You select that. It says, there's a link on there that says available vaccine sites. You select that, and it gives you a list of all the locations that are first dose vaccination sites that are supported through the Southern Nevada Health District. Now, it's not an all-inclusive list for making an appointment. It's just the SNH supported sites. So other sites like the Encore that's provided by our community partner UMC, UNLV site, they have different websites to go to register for their vaccination clinics and making appointments. But you pick a day and a location. If you wanted, this Saturday at Southern Nevada Health District for at 280 South Decatur, you select that link and look for the available appointments. If there are appointments available, it will program and show you that slot is available. You enter your name, identifiable information, how you want to be notified, in email, by text message, and you make the appointment. The system automatically sends you a confirmation that you are confirmed for your appointment, date, time, location to go get that vaccine. We ask that people, wear their mask, wash their hands, and back up and maintain social distance the day that they're getting the vaccine at 280 South Decatur, to line up in the line that we have established there. They go through, and once they get there, they'll get to the registration desk. Generally, it's an iPad that we use via Wi-Fi to pull up the appointment date for that individual. We confirm the required information that they truly are the people that made the appointment. They're asked to complete out additional information if they're feeling healthy today, if they're feeling sick, if the necessary information to get the vaccine. They're seated in our waiting room. They're called back when a clinician is ready to administer the vaccine. They, at that point, answer any questions that the individual may have regarding the vaccine that they're about to receive, as well as provided patient information sheets on the either Moderna or Pfizer vaccine. They receive the vaccine. They're given instructions to take, Advil and anti-inflammatory for pain. For that, to drink plenty of fluids, and then they're escorted to the waiting area to wait 15 minutes before they're able to depart. We were checking to make sure that individuals have safely received the vaccine and do not have any allergic reactions to the vaccine. And then once they leave, they are provided a card that on that card it lists the type of vaccine they received, the lot number, their name, date of birth. Flip it over to the backside, it provides the next earliest date that they can get the second dose vaccine. We encourage people not to try to get a vaccine before that date on that card. A lot of our general public only waits 2 weeks and then tries to make another appointment to get the vaccine. For efficacy of the vaccine, people need to wait the full term of 21 days up to 6 weeks after they get the first dose. And then if it's one of our community partner site locations, they might at that point make a second appointment for them. At SNHD locations, we do not do that yet. We might in the future to improve our processes and the way that we inform the public on how to get second doses, but right now, because of the limited amount of vaccine that we get can't schedule a month out the appointments that we have, because we don't know, we'll know a week before then whether we'll actually have enough vaccine. In a nutshell, that's pretty much the process.
Sure.
We rely on the honor system greatly. I mean, you know, it is, you know, we request patience of the public. We have to be patient ourselves. You know, the fortunate thing is that vaccine is available now. We're in the process of getting that vaccine out. We've just come through a year of time where people have sheltered in place and they're antsy to resume their lives and get back to work. You know, the optimism is that we have the light in the end of the tunnel. Really, for administering large amounts of vaccine, we have a less time to go that way than just the past year that we've come through. Really, it comes down to patience, but we will turn people away if they're not in the priority groups that we're targeting at the moment. If you're a young individual that is healthy, that would be classified under the general population, if you make an appointment, show up to that appointment, get up to the front, and we check the registration information, we will turn people away. That is just, we're asking for the public's help to thoughtfully review those tier groups and really identify that they are, in fact, part of the group that we're targeting through the vaccine. Right. You know, I mean, it'd be difficult to identify if somebody had monoclonal antibody infusion treatment. If they had COVID in the past, we do have information to validate whether somebody was tested at one of our COVID testing sites the past year to see if they tested positive for COVID. But really, it's based on public information, getting the information out to the public to say, if in the past 2 weeks you had COVID, that really you're not a prime candidate for receiving the COVID vaccine at this time. Your body already has the antibodies. The vaccine is not going to be have as much efficiency in your system receiving that vaccine. So we ask people for patience to allow that vaccine to be given to somebody else who truly is in a higher risk group and actually can get the vaccine. Correct. That number sounds about accurate for the amount. If you look at the total statewide of vaccine that we receive, it would be close to 30,000 for the entire state. So every clinic in Reno, rural and frontier Nevada that is administering vaccine, that's not a whole lot. Yes, we have 73% of the population down here in Clark County, but even the amount of vaccine that we're getting is not keeping pace with the demand. And with the tier groups that we currently have open that we're administering vaccine to, that number far exceeds the amount of vaccine we have. But we're optimistic with our federal partners that we're receiving weekly shipments of vaccine, that we'll continue to get that, and that the amount of vaccine we get each week will exponentially increase as the manufacturer produces more vaccine. Correct. Correct. And really, I think we have a very good capacity right now. We've a lot of our incident management team through the Clark County, working with Health District's Incident Command System, we're identifying and planning additional community site locations across the valley, working to secure the resources necessary to logistically support those vaccination sites and arrange the staffing and vaccinators. And really where we're going to augment the existing clinicians that we've had that have worked tirelessly the past year to do COVID testing, now have revamped to provide COVID vaccine. We need to lean on our community partners at the state, federal, and local level to assist us with providing the staff necessary to man those clinics. Yes, every day. I mean, we expand capacity. We have worked to identify individuals that could support a call center to be able to not have people call the health district and get pre-recorded voice messages, but they actually get a physical person where they can ask the questions to. But, you know, a lot of the information that these individuals at the call center are providing is on our website. There's frequently asked questions there. Every question that somebody asks about where I can get vaccinated and where I can get COVID testing are on our website. So people just need to read the FAQs. If they get a person at the call center, the person at the call center will be pulling information, the answers to people's questions, really from the FAQs that are posted on our website. So it is, you know, we encourage their folks to call us, but we ask for their patience too. If they get a voice recording and can't navigate, I know a lot of us want to talk to a physical person sometimes, but right now, health district personnel are engaged in community response for COVID. Every, you know, person that we identify, even leveraging our community partners, we're using and training those individuals to staff our call center. And that is really, it's important to get the information out there to reassure the public that, you know, their second dose vaccine, that they're not going to miss out on it, that we will notify them, and to be patient to get that. It's important that the notification that they get actually has the link to register for the convention center site. We did, as of 5 p.m. yesterday, put that location for registering second doses on our website, expanded server capacity to handle the volume, and so really we encourage people to go to the website now, whereas 2 days ago they might not be able to make an appointment for the convention center. They can do that now. So every day we do corrective actions. We look at how we, in our operations, how we can improve things. We do corrective action and we implement those changes.
Yeah, what is your message to the public, citizens of Nevada and also tourists? Don't put up on the 3Ws. We know we're seeing the end of the tunnel. What's your message to the public on being true to the 3Ws?
Correct. I mean, really, it's uniform and consistent messaging, even with visitors to our state. I mean, tourism is one of our #1 industries in the state. We welcome our visitors to come here, but we want them to come to our community and be safe. And the way that they're going to do that, I think, is by reinforcement of wearing a mask, social distancing, and washing up. We've done a lot with our resort property partners. We have close working relationships. We, on a daily basis, consult one another and make recommendations to safely manage visitors that are coming to the state. Really how they operate while they're resting and relaxing in our fair city. And so really I think reinforcement is the way that we do it.
We really emphasize those 3 Ws specifically because getting the vaccine, if you're getting the first dose, it does not offer you complete immunity from COVID-19. So you have to continue making sure that you have those practices in place to keep yourself and your family safe. So we'll take the next question.
Well, we don't have issues with doses going bad per se. Now, if with the amount of vaccine operations that are occurring across the country, generally on the patient information sheets that people have, it will have a 1-800 federal call number for people to call if they feel that they've had an adverse reaction to the vaccine. They call it, they report it. Situational reports get distributed across the country to health departments, state agencies, and federal partners. We do read those reports. If they happen to have the particular, whether it's a Moderna, Pfizer, and the lot number, we will look to see if we administered any of those doses. And then we might do a follow-up through our contact tracers and disease investigators to reach out to individuals to say, hey, you received this particular lot of Moderna vaccine. Did you have any adverse reactions for it? If they say no, then really we just continue to monitor it and make sure that no cases of individuals that received a particular lot of vaccine show up at the emergency department down the road. But really it's information sharing and information dissemination, and that's pretty much how our process works to get that info.
Okay, we have time for one more question.
I don't think that's what he meant. I think he meant, do we as a state, when we have a vaccine, because do we have any that have been mishandled or neglected through some, happenstance that have gone bad, that were perfectly good, that have gone bad, that we can't administer?
No, I mean, at our sites, for example, no operation is purely 100% goes off without a hitch. Even in manufactured vaccine syringes that we receive, one in a million, you'll have a faulty syringe that breaks while you're administering or drawing up vaccine from a bottle. Could it be wasted? Yes, it can be wasted. If somebody drops pulls up the vaccine in a syringe, drops it on the ground, it breaks. But we do have processes in place to track wastage of vaccine. And I think for the amount of wastage that we've had in the state, really it's an insignificant number that we're due. In the greater scheme of things, we administer far more vaccine than we actually have errors in administering vaccine. I don't know. I would have to get back and work with our operations staff to see what we're reporting to the Nevada State Immunization Program as far as wastage. And that's pretty much for every venue site that is administering vaccine, tracks the wastage that they have, and there's usually a justification and reason for that. But I
So
don't have that info.
With that, we can follow up with you specifically. We'll have someone from the Southern Nevada Health District look that information up for you. But I know you haven't asked a question yet, and you had a question, so we'll go with you, and we'll close out the press conference.
The governor of Nevada released a letter to HHS saying that Nevada had not received its appropriate allocation of vaccines. Then it came out that maybe there was some confusion over whether or not we could order a full allocation of certain vaccines. I believe that's been confirmed since then. Does that confusion in any way hurt Nevada's ability to get and distribute vaccines?
No, it does not hurt Nevada's ability to order the vaccine. That system remains intact and in place, where every week Nevada is notified of the amount of vaccine that they can order, and then they go in and they order it in the system, and then it goes out here to sites within the state. So that has not changed at all. The system still works perfectly intact as it is. No, ma'am, I'm not aware of the confusion that occurred with it.
I could certainly look into that for you and follow up. So with that, if there are questions that you have that weren't answered, if you received the media advisory, it's a very simple email. It's ASPR, A-S-P-R, media@hhs.gov. That goes to our media office. I'm one of the people who receives that. But I want to make sure that you have the opportunity to have your questions answered if you didn't get them answered here. So with that, we're very happy that the site is open, and we are very thankful for our partners, and thank you for coming today.